At the ESH meeting, I talked about patients with PH-like ALL and gave an overview of some of the diagnostic challenges in the genetic testing for PH-like ALL patient identification, and reviewed some of the incidence across the age spectrum from children to adults, as well as their high risk of relapse. We finished the presentation talking a little bit about the potential for addition of tyrosine kinase inhibitors to chemotherapy for patients with different subclasses of PH-like ALL, and reviewed some of the clinical trials that are ongoing for this patient population. Identifying patients with PH-like ALL can be quite tricky. We have learned that most of the fusions that we see in patients with PH-like ALL are cytogenetically cryptic, so they can be missed on conventional testing. We've spent a lot of time, I think now, optimizing FISH probes for some of the major PH-like 3' kinase fusion partners. So genes like CRLF2, JAK2, EPO-R, and then the various ABL class fusions involving ABL1, ABL2, CSF1R, and PDGFR beta. So this is actually a very helpful test modality for identifying these patients, at least on initial suspicion, within about a week's time. We've also spent a bunch of time optimizing the potential for flow cytometry of the thymic stromal lymphopoietin, or TSLPR, surface antigen that's encoded by CRLF2 gene. The CRLF2 gene rearrangements are the most common type of PH-like ALL that we see, and that can help us to identify patients with potential PH-like ALL within about 24 hours. Of course, detailed molecular testing is really needed to confirm the precise PH-like kinase fusion, in particular with identification of the 5' partner gene. And so we're using a lot of RNA-based fusion platforms now to identify the specific kinase fusion involved for these patients. That testing is a little bit more time-consuming and takes often 2 to 3 weeks to identify, but is probably the most useful testing modality that we currently have. In pediatrics, we are currently using, at least in North America, something called a low-density microarray screen, or LDA. This helps us to identify patients who have a kinase-activated gene expression profile consistent with PH-like ALL. It will also help us to pick up patients with pH-positive ALL and a couple of other subtypes. I will caution the audience that this is really a screening test that we've used in the Children's Oncology Group to help us to identify, the approximately 15 to 20% of pediatric patients with PH-like ALL who merit the more expensive downstream molecular testing. And it's probably not a necessary tool for adult patients, for instance, but is really just a helpful screen for us in pediatrics, because it's quite rapid with a turnaround time of about 48 hours, and it's quite inexpensive at a cost of about $60 US.